Okay, today we'll be doing an EKG on Brent. We've already added in his age, gender, race, height, and weight into the computer, and now we'll begin the test. The first thing Allison had done is wash her hands and remove the 10 electrodes from the package. Now she'll be using the abrasion pad to clean off the area. It's very important to definitely get in and get all of the first layer of skin off, because it can cause a lot of artifact, which is extra noise that shows up on the EKG that could make the test come out wrong. If you can talk to your patients before the test, it's good to tell them not to use any lotions or any thick soaps, because we need the test to be very clear of any excess stuff on there to cause any more artifact. If the patient has a hairy chest, you'll also need to use a razor blade to shave off the excess hair. If the sites are not clean, then the pads won't stick, and if the electrodes don't stick, then you can't get a good reading. And if a patient is on a treadmill sweating, you wouldn't want them to come off. So it's really good to make sure that whole layer is off. You can see Allison scrubbing and getting that completely off. It's not always comfortable for the patient, but it's necessary for the test. She has 2 more sites to do, and then she'll be finished. The standard method for the Mason-Likar EKG would be to place electrodes down by the ankles and up by the arms, as well as on the chest. But today we'll be using the modified exercise Mason-Likar method. So we'll be using 2 electrodes down on the abdomen and 2 up on the shoulders rather than on the arms and the ankles. You can see that she's using the alcohol pad to completely clean off the area so that the electrodes will stick better. And it's very important that she doesn't touch the areas after she's wiped them off with the alcohol, because we have oils on our fingers that could keep the electrodes from sticking during the test. Now these are the electrodes that we'll use. There's gel on the bottom of them, and that's what produces the positive charge throughout the reading for the test. Now you want to be very careful as to not touch any of the sticky part of the pad. You just want the very outside part of it. So the first one she's placing on there goes excuse me, on the distal interclavicular fossa at the top on the right side, and then she'll place the left side distal interclavicular fossa. The next pad she'll stick is V1, which is placed in the 4th right intercostal space at the sternal border. Then she'll place V2, which is also placed at the 4th left intercostal space at the sternal border. For now, she'll skip V3 and go to V4, which is placed in the 5th left intercostal space at the mid-clavicular line. And then halfway between, she'll place V3, which is between V2 and V4 at a diagonal. Next, she'll place V5, which is placed in the anterior axillary line at the same horizontal plane as V4. Next will be V6, which is placed in the mid-axillary line at the same horizontal plane as V4. The next one will be actually our ground. We'll go to our left one first, which is placed in line with the abdominal above the iliac crest. And the final one she'll place is our ground one, which is in line on the right side with the abdomen at the iliac crest. Okay, this test is the Bruce protocol test. It's to do a VO2 max test. For this purpose, the computer will be running the test, but if you're running it yourself, every 3 minutes you'll increase the grade, starting at 10 and moving up to 12, then to 14, 16, 18, and 20. The speed will start out at 1.7, and then it will gradually move up to 2.5, 3.4, 4.2, 5.0, and then 5.5. At any point in time, the person who is doing the test can ask to stop if they're not feeling comfortable. You can see Brent has this shirt on. It's actually to hold the electrodes in place so we can get a reading throughout the whole time. Allison has already done his blood pressure reading, so now we'll begin the test. Now the grade is up to 10 and the speed is at 1.7. During each stage, we'll need to get an RPE from the client. Now Allison will be taking a blood pressure. As you can see, Brent will be resting his arm on her shoulder so that there isn't any chance of getting the wrong reading. One blood pressure is done during each 3-minute interval, but during each minute we'll get an RPE and we'll also get a heart rate. What's your RP?
10.
The treadmill moves to grade 14 at a speed of 3.4. The treadmill moved to a 16% grade at a 4.2 speed. The Bruce protocol is a max VO2 test, therefore we can take the participant all the way up to the top. But however, if this had been a submaximal test, we would usually stop the participant at an 85% of their max, which is where he is right now. RP?
14. Cool.
Now the treadmill is at an 18% grade at a 5.0 speed.
It's on, yeah.
Is it? And like we had said at the beginning, the participant may stop the test at any time. He has chose to stop now, so now we'll do a cool down. Good job, Brent. Nice job.
Thanks.
Okay, now during the cool down, we'll make sure we get the heart rates and the blood pressure to make sure the patient is recovering.
During this test, the heart rate increased as the workload increased. The EKG had a normal sinus rhythm, and there were no signs of ST segment changes. Tachycardia was present, but that's what's to be expected. This clinical exercise test was without incident, and Brent will be cleared for exercise.